Okay, so we're going to start by scanning the room. I have my blank piece of paper here. This is the front and the back side of it. Okay, let's go ahead and get started. Start by sanitizing my hands. Hello.
Hi.
I'm Amalia Floyd. I'm an OT student at the University of St. Augustine. How are you doing today?
Good.
Good. Can you confirm your name and your date of birth for me, please?
That's Tyler Moyer, 12396.
Okay. So today we are going to be testing your muscle strength and your range of motion. And with this, it's important to see if you have any limitations. And it starts a baseline for us. Okay. Do I have your consent to begin?
Mm-hmm.
Okay. So what we'll be doing is we call shoulder abduction. So with this, you're going to bring your shoulder out and go ahead and bring it up as high as you can. All right, and bring it back down. How did that feel?
Good.
Any pain with that?
No.
And I just wanted to state that before we would do any of these tests or during the test, I would have a mirror and our assistant here to watch my patient's face to make sure that he was in no pain. Okay, and we would usually take the patient's shirt off, but in this case we are not going to. So go ahead and do that motion again. All right, bring it down one more time. And this time you're going to stop about halfway, like right about here, and I'm going to apply some pressure to you, okay? And I'm stabilizing at your scapula. So go ahead and lower it again. All right, and you can bring it up to that halfway point, and I'm going to apply some pressure. Just go ahead and resist me. Okay. And can you do that one more time? And go ahead and resist me. Okay. And I would grade you as you're at a 5, and I would test the other side. Now we're going to move on to the muscles that the primary movers of this motion is the middle deltoids and the supraspinatus. And something that you could do this motion for is, let's see, you could you could be reaching up for something above your head. You could be putting your shirt on. When you put your shirt on, you have to bring your arms up. So now we're going to move on to radial deviation. So with this, I'm going to have you bring your hand on here. And go ahead and do the left hand. And I'm going to go ahead and bring this chair around to sit with you. Okay. So we'll be using this Goni, Half Moon. And so with this, the movement is going to look like, go ahead and rest your forearm on here too. So I'm going to stabilize you here. And so it's radial deviation, so you'll be bringing your hand closer to your thumb. So like you're bringing it towards the thumb. Can you go ahead and show me that motion? Okay. And any pain with that?
Mm-hmm.
Okay. So you're going to go ahead and do that motion again, just like that. And I'll be placing my Goni on your hand while you do it. My axis will be the capitate. My movable arm will be in line with the third metacarpal, and my stationary arm will be in line with the mid forearm. Starting at 0, go ahead and do that motion for me. Line that back up. And you got And you got 10 degrees. Actually, it is 11 degrees. And that is good because the normal range of motion is 0 to 20 degrees. And do you have any questions for me? A motion that would be done for this, for some people, if you're doing it in the air, you could do that, like be holding a very large cup or a heavy cup and trying to hold it up, so you're bring your wrist this way to try to compensate for it. And I also did not state the gravity eliminated for the shoulder abduction, and for that we would have the patient lay supine, and we'd bring the arm out on the bed, and the therapist would be helping the patient throughout all of that. Let me think if I'm forgetting anything. I would also test the other side. Okay. I think that's it. Do you have any questions for me?
Nope.
All right. Have a great day.
Thanks.